So, of all the things that we plan for so carefully in our lives, so think about childbirth, think about weddings, think about careers or retirement. There are so many people who don't necessarily plan for death or leave it until the last minute, when so many other things are changing and now feel out of control. Planning for declining health and end of life is about person-centered decision-making. Person-centered decision-making is making sure that you have a voice in your healthcare decisions. When we're first diagnosed with a serious illness, if curative treatment is available, everyone might be on the same page without a lot of discussion being needed. But all treatments have pros and cons, costs and benefits, and we deserve to know what these are and really be able to make an informed choice about what we want and what we don't want. Advanced care planning helps us think about the future and what we want for our own care. It's an exploration of our values, our beliefs, our goals, and our preferences about our lives, our illness, and our death. Advanced care planning ideally starts when we're healthy and gets more specific with a new diagnosis or a change in health status. Advanced care planning encourages us to think about what makes our lives meaningful. What are our hopes and worries about life and death as illness progresses? And what's most important for the people around us to know? Advanced care planning can just be an unstructured conversation, or it can be supported by a workbook or guide, but it's not something that has to be written down. It's important to know as well that an advanced care plan is not the same as a DNR or a do not resuscitate order, which is a process that is put in place when a person decides they no longer want to have CPR. It's important to understand the costs and the benefits of CPR as someone advances in an illness trajectory, and that's part of an ongoing goals of care conversation, but it's not the same. Knowing where you're at in the illness trajectory and in your own illness journey is an important part of person-centered decision-making. Without knowing about your own situation, it can be hard to make specific informed decisions about your care. And that's the purpose of a goals of care conversation. So a goals of care conversation is when you, your chosen decision maker, and your healthcare provider check in and talk about your illness and how your values and your beliefs and your goals and your preferences are being respected in your care, or how your priorities might have changed in light of new information about your illness and treatment options. For healthcare providers, the Serious Illness Conversation Framework is a great guide for goals of care conversations with person-tested language, and it's a very natural flow to the conversation. So that's a resource as well for those of us who are coming into these conversations from the other side. When you're considering your values, beliefs, goals, and preferences, it's also good to think about who is it that needs to know this information about you. Certainly your healthcare providers do, but you also want to think about who would want to speak for you if you were not able to speak for yourself. Under Ontario law, there are default substitute decision makers identified for you in a situation where you haven't appointed someone else. So if you're married or in a common law relationship, your spouse is your default substitute decision maker. If you're widowed and have children, your children will jointly share the responsibility of being your substitute decision maker if you're unable to speak for yourself. But you have the ability to name a power of attorney for personal care if you want to designate a specific person. You don't have to go to a lawyer to do that. All you need are 2 witnesses, and you can download a form from the provincial website. It's good to keep this in mind because the person who's closest to you may or may not be the best person to speak for you if you're unable to speak for yourself. The best power of attorney is one who can most closely align with your wishes. If you know that a loved one is going to have a hard time following your wishes, or you want to alleviate them of that responsibility of decision making, it's okay to have that conversation to say, I really want you to be able to be my daughter or to be my husband because I care about you so much. Whether you decide to keep your substitute decision maker or name a power of attorney, it is still so important to have a conversation and to revisit that conversation as your goals of care change. Ideally, the people who are closest to you and your power of attorney should all have been able to hear from you what's important to you and what you want before anything that threatens your ability to communicate that. Writing it down in an advanced care planning document like the one created by Speak Up Ontario can be helpful, but it's the conversation that is really going to stay with someone. And of course, this is an ongoing conversation that can be revisited at any point in the illness trajectory, but especially when someone has had a major change, such as a change in functioning, or you're starting to see some of those indicators of decline that Dr. Nolan talked about earlier. So talking about options for care, moving into kind of making some of those plans. An activity that we sometimes see in palliative education, and Lorna's gonna kind of be smiling to this because she does that palliative education. She does these kinds of activities with us. Or advanced care planning workshops is when we're asked to picture our own deaths, or to maybe draw our own deaths, or write about them, or otherwise describe them, reflect on them in some way. Sometimes these aren't necessarily realistic. For example, I drew myself on a dock by my childhood cottage, but I know it would be unreasonably hard for my family or a funeral home to get down the rocky steps that led down to it. But it helped me to think about the things that were important to me, where I might want to be buried or have my ashes spread, that I would want to be able to feel the wind in my hair. Exercises like this help us think about what's important to us, which is good because our ideal is not always possible. Most Canadians want to die at home, and for many, this is possible, but sometimes it's not. A person can live much longer than expected, which can cause challenges for family members who have limited time off work to provide care, or care needs might exceed what's available in the community. Home care teams do amazing work, but there are limited resources, and a person with a serious illness might unexpectedly need more care than these services are funded to provide. Even private pay care isn't always available, or isn't always available to bring in as quickly as you need it. Family caregivers find caring for a loved one to be rewarding and deeply meaningful, and it can also be exhausting and more intense than either the person or their loved one expected. That's why it's important to know your options and to have a backup plan. If things break down at home, the default can be that you end up in the emergency room, which may or may not be where you want to end up. This might not align with your wishes. We do have another option in Huron County, which is hospice. So hospice is an option for end-of-life care in Huron County, and contrary to popular belief, is not limited to the final 2 weeks of life or when someone is actively dying. When someone stabilizes or we're able to get their symptoms under control, sometimes residents will even go home. When a person's goals of care are to maximize their quality of life and they are no longer pursuing life-sustaining treatments, or life-sustaining treatments aren't possible, hospice is a wonderful alternative for care. Some myths that we hear about hospice are that it's dark, it's depressing, it's sad, that it means giving up. In fact, hospice is a place to live well until death occurs. Often there is much more living and healing and conversation, sometimes even lifelong healing that takes place in hospice. There's music, there's home-cooked meals for those who would like to eat, there are pets, there are new and old connections, there are tears, but there is also laughter and joy. We also hear that hospice is expensive. It's not. There is no cost to staying at hospice, no matter how long you're here for. And there are supports available for anyone who isn't able to cover the cost of transportation to get here. We sometimes hear that maid isn't allowed at hospice. This is no longer the case, though different hospices are each approaching maid differently. There are 3 hospices in Huron County. There's Huron Hospice in Clinton. There's Jessica's House in Exeter, and we have Tracy here from Jessica's House today. There's also Rotary Stratford and Perth. We're from Huron Hospice, so that's what we're going to talk about kind of here, though this information is going to be similar between each of our homes. And on this slide here, we have some pictures from from Huron Hospice, just to kind of give an idea of what a stay might look like. So we have a big family meal going on there. That's just sort of a picture of the building. It's an example of one of our rooms with someone coming in, doing some music, and a living room where family members might spend some time together. So I've put the numbers here for Huron Hospice and Jessica's house. You can call and speak with Tracy or I or any of our nurses if you have questions about hospice or about our referral. All referrals for hospice in Huron County come through home and community care. So if you're connected to a home care nurse or a care coordinator, you can speak with them, or you can call this 1-800 number and ask to speak with intake if you'd like to be assessed for a referral. Home and community care is also available to you if you have a serious illness. You're finding that things are starting to get harder at home. You're starting to see some of these declines. You can self-refer at that point as well. You do not need to wait for a healthcare provider to say, it's time to sign you up for home care. You do not need their permission to self-refer. If you feel that you have needs in the home that aren't being met, you can reach out to home and community care and get an assessment set up. And Laura can talk a little bit more about that if anybody has questions, as she is here with us today too. The Waiting Room Revolution is a fantastic resource for patients, for families, for healthcare providers even. It's a movement that has been started by Dr. Sammy Winemaker and Dr. San Tsao. They have a podcast at waitingroomrevolution.com. Dr. Sammy is also on TikTok. She does some great sessions. They are a palliative care physician and a health services researcher. They have also written a book together called Hope for the Best, Plan for the Rest. This book is available through the Huron County Library System. We hope to be receiving more copies of this book, so check back with us at the hospice if you're seeing that there's a long wait at the library and you want to check it out. I've also provided a link to the National Advanced Care Planning, to some National Advanced Care Planning resources if you're looking for more information about that. Another resource is Speak Up Ontario. These websites can provide you both with some guidance for starting conversations, like some tips and tricks, and tools to document your wishes if you want to take that step as well. There's also a Health Canada fact sheet about what to do when facing a serious illness that can be a good starting point, particularly that can be a good starting point around starting some of those conversations with your healthcare providers if you feel like you want more information. The link was not friendly to put up on a PowerPoint slide, but you can do a web search for it, or you can give the hospice a call if you'd like, and we'll send you the link. And that is all I have for the presentation. So I'm not sure if you would like me to get out of the slides or leave this up so folks can see the resources and have a chance to write them down. What do you think, Pat?